Welcome back. Well, November is National Diabetes Month, and nearly 26 million people in the U.S. have diabetes. And because pets can also be affected as well, it's also National Pet Diabetes Month. Our pet vet, Dr. David Visser, is here to explain this common and really serious condition in pets. Dr. Visser, welcome.
Thank you. Good to be here. And it'd be nice if we didn't have to celebrate a disease, but this is about awareness. We need to have people be aware of what to watch for with their pets. Of course, that's the reason I'm here, but to parallel it with the fact that diabetes is a very common and significant thing in people as well. And you mentioned all of those millions of people who have diabetes, and there's actually an entire set of the population don't even know that they have diabetes because it's pre-diabetes or leading toward. And pets can be in that same sort of situation. So we want to bring awareness of what people should watch for in their pets.
Right, so like you saying that we have awareness in ourselves, like I'll know like, oh, when your weight is fluctuating or with different things about yourself, but what's that awareness look like when we're looking at our pets and trying to see what's going on with them?
We really have to kind of figure ourselves as the parents of children in this situation, and children might not necessarily know what's going on and complain and identify, and pets are the same kind of way. We have to be reading them about the signs that they're showing because they're not likely to complain a whole lot, may not necessarily show signs that there's an ailment going on. Their goal is survival and to cover signs, and that makes it harder for pet owners and veterinarians to figure out what's going on.
Okay, so humans and pets, we sometimes have a lot of the same diseases. So a reminder, like, about what diabetes is and why it's life-threatening, particularly for pets. Like, what causes it?
Diabetes is related to insulin and the response to insulin. And insulin is a hormone made by the pancreas. And you either are not making enough of it, you're not making any of it, or that the body is resistant to its functions. And those are the bases for how diabetes manifests. When you don't have insulin, insulin is kind of the bridge from the bloodstream to the cells that need sugar. And without that bridge, the sugar just builds up in the bloodstream and then goes out through the urine after it reaches a certain amount. And when it goes out through the urine, it brings a whole bunch of water with it, creating an increase in urination and as well as an increased thirst to make up for it. But in the meantime, those cells that needed that sugar are starving. And so they're trying to figure out what to use instead of sugar, and that creates this complicated negative metabolic effect that makes pets feel toxic, people for that matter too.
Oh, no. Okay. Oh, that's not good. So what should pet owners look for to cue them in diabetes? I'm assuming more water intake.
Exactly. So that increase in the urine production is the first thing. People might not necessarily know that, but then they notice the increase in thirst to make up for it. When they're drinking more than normal, it could be not just that the dish is emptying quicker, but they might be looking for water in novel places, drinking water outside when normally just going outside to urinate, or seeking water at the sink or the toilet for that matter, just basically unique locations, so this increase in water. But then they're also increasing their urine production, and that might mean that they have to go out more frequently. It might mean that there's a longer stream. So be aware, not just letting your pet out, but watching to see what those patterns are. But it's also possible that this overproduction of urine is an overburden to the bladder, and there can be some leaking. So wet spots at night where a dog has been sleeping, leaving some urine spots, or urinating in the house when normally they didn't, could be an issue. And some people may notice that urine, as it dries on a hard surface, can actually be sticky, and that's because it actually has a high sugar content. Not to be graphic,
yeah, I'm sorry, Dr. David, and my thought was, you don't let that dry on that floor. That was really my thought was.
Try, clean it up, but then also be aware of why it happened in the first place.
Exactly, and those aren't symptoms to ignore because it just gets worse from that point moving forward if you try to just ignore it.
Yes, those might be the early signs, but actually diabetes, when it goes unmanaged, it gets into a more negative domino effect. So the weight loss that occurs because those cells are not getting all the nutrition can later develop into a lack of appetite. And initially there might be a great increase in appetite because all of this starvation that the body's cells are going through, but it turns into a toxic effect later with that lack of appetite. Also, pets then become more toxic. They can be losing so much water that they become dehydrated. They can change their alertness and become weaker and tired. And this is not only a condition that can create these signs and the devastating issues, but it can be fatal if it is untreated.
Oh no, not a coma.
Pets can go into some serious adverse effects from this. It's a life-threatening condition. So this is why we want to tune into those signs.
Well, I know for people, like, they can mess with their eyesight. They lose like extremities, like having to be amputated. So Oh, okay. But you did mention there's a new treatment on the horizon for diabetes in pets.
Yeah, so traditionally, we've either been able to use medications to increase the insulin output by the pancreas. That can work in cats. It tends not to work in dogs. The mainstay has been using insulin to basically give replacement hormone therapy. If they're not making it, we need to give it. And that calls for owners to be able to give an injection at home, and they're real small needles, and it works out okay. But there's a new medication called Bexacat and also Cinvelgo, which these are two medications that are similar to Jardiance, which a lot of people are seeing the commercials for in people.
Okay.
It actually was approved in cats before it became approved in people for this class of medicine. And basically what it does is it lowers the sugar levels so that the insulin that is being produced is not being overstressed. The pancreas is not being overstressed. So this can help in pets that have this, but it's an important thing to talk with your veterinarian, not only about the signs and the diagnosis, but as your pet is diagnosed, cats in particular, as cats are diagnosed with this condition, talk with your veterinarian about whether this new novel set of medications could actually help avoid the insulin type treatments. I even heard that there's a long-acting insulin treatment that might be once a month for diabetic cats. That's not here yet, but it's something to watch out for, and you can be sure the pet vet is going to stay tuned into that.
Well, that is some good information right there. Thank you, Dr. Visser. I'm always like, I'm always locked in me, start talking about the cats, right?
Absolutely.
I'm like, okay, I'm paying attention.
This is it, yeah.
But if you would like more information on Pet Diabetes Month, you can go to www.petdiabetesmonth.com, and we'll also have that link on our website as well. And of course, if you have any questions about diabetes in your pet, you can get in touch with veterinarian or your veterinarian, or contact the pet vet at the Center for Animal Health by calling 888-PETS-VET, or you could always shoot him an email at michianapetvet@comcast.net. Also, George's dog was not feeling well last weekend, and you immediately got him in, so kudos to you, Dave. We'll be right back after the break.